I am tired of women believing that synthetic Pitocin and naturally occurring oxytocin are the same thing, because they're not. So grab a coffee or tea, get comfortable, and I will tell you everything you need to know about the difference between Pitocin and oxytocin. If you don't know me, my name's Sophia. I started Sunset Birth to help women feel peaceful, prepared, and confident for labor and birth. I'm a birth doula and childbirth educator. Like this video, subscribe to this channel for more content on pregnancy, labor, and motherhood. When I am teaching parents about the physiologic process of birth, I talk about oxytocin all the time because truly, of all the hormones involved in labor, oxytocin is the star. Oxytocin is known as the love hormone. It's released when our body feels safe, when we have skin-to-skin contact, when we feel warm, when we're, cuddling with our partners, when we're hugging. Oxytocin is the forefront of labor because it stimulates our uterus to contract. This is why it's very confusing when doctors approach women with an induction of Pitocin, because it is synthetic oxytocin, but there are a lot of differences. The reason that if you get induced with Pitocin, you have to be on continuous fetal monitoring, so you'll have two places where they monitor your heart rate and baby's heart rate on your belly. Your contractions are going to get way more close together, and your uterus is potentially going to get hyperstimulated, which could cause stress to the baby, which is why you need to be monitored. Pitocin contractions are stronger and more painful than naturally occurring contractions for this huge reason. Pitocin does not cross the blood-brain barrier, because when you have naturally occurring oxytocin, that does cross the blood-brain barrier to stimulate beta endorphins. Endorphins that are the feel-good hormone. People call this nature's morphine, and this is what helps women get through the pain of labor contraction, which I just think is so cool, and one of the biggest hallmarks of why these hormones are so important to physiologic birth. Because contractions are a lot more painful with Pitocin, you have a higher likelihood, if you are being induced with Pitocin, to request an epidural or other pain management, which totally makes sense if your body is not being stimulated to produce those beta endorphins that we talked about. The thing is, when you get an epidural, then your movement is further minimized because you have to stay in the bed with the epidural, which could cause things not to progress well, and therefore increases your likelihood of having those instrumental delivery techniques used, like forceps or vacuum. Because Pitocin causes these back-to-back intense contractions that could cause stress to the baby, they could cause changes in baby's heart rate called decelerations, which are really a problem if they're happening after the contraction. So if your baby starts having these changes in their heart rate, the care team might prompt you to have a cesarean section as their recommendation. So it's really important to know this cascade of interventions that can happen when you're on Pitocin that could cause stress to your baby, that could cause you to have the need for something like that. And I've heard so many women's stories saying, thank goodness I was in the hospital, but really it's this cascade from getting that Pitocin and having all these things happen that necessitated the need for a C-section. With breastfeeding too, studies have shown that Pitocin interrupts that body's natural production of oxytocin, which is connected to your production of prolactin, which is the hormone that stimulates your breast milk to start coming in. You can help mitigate this with more skin-to-skin contact with your baby, feeling, that safety with your partner and that touch that we talked about earlier, and stimulating your breast to help release more of that natural oxytocin to mitigate those issues with Pitocin. If you are needing to be induced with Pitocin, I just want to remind you, I'm not saying that Pitocin is an evil or bad drug to use. Again, it is a tool in the toolbox. But I will remind you, you have total control of how Pitocin is used in your labor. Here are just a few ideas of what you can do to optimize the use of Pitocin. You can request to have it start at the lowest dose possible. You can request a slower increase of Pitocin to see how your body does with each increase. Usually it will be increased every 15 to 30 minutes, but you can ask if you can increase it over 30 to 60 minutes instead. Some nurses just get so much in the habit of increasing the Pitocin that they might come in and not tell you directly that they are increasing your Pitocin. But I will say that that is not okay, and nothing should ever happen without your explicit consent. So if they're ever messing with your IV, just ask, like, are you increasing my Pitocin? Like, can we talk about it before you do? See how I'm doing? So you can request to have that explicit consent before they increase your dose. And know that you can request to lower your dose or stop at any time in your labor. If you are feeling like, man, things are just like getting really, really intense, you can ask to have them lower the dose or stop increasing it for a couple of hours. I just want to remind you that you are in control of that Pitocin. I will say that different hospitals have different protocols, namely high dose or low dose Pitocin protocols. So I would just ask your provider what their protocol is and how they, if you are going in for induction, how they're going to manage that Pitocin. I, of course, will say that there's always nuance and that Pitocin is a tool. It's an important tool that I'm glad that we have at our disposal because some women do need to be medically induced. But I believe that in the United States especially, induction is overused. Offering elective inductions at 39 weeks is not best practice. A newer recommendation of women getting elective inductions at 39 weeks to reduce their rate of cesarean comes from the ARRIVE trial. And I will do a whole video on the ARRIVE trial, but there have just been a lot of criticisms for that study and how it was conducted, that the results don't really mean that we should have everyone be induced at 39 weeks with Pitocin for the reasons that I've just mentioned, that it could cause downstream effects for labor that could have negative outcomes and a higher rate of cesarean deliveries. Didn't know I am a Lamaze certified childbirth educator, and Lamaze operates on 6 healthy birth practices. And healthy birth practice number 1 is let labor begin on its own. And this is a huge reason, is that when you have naturally occurring oxytocin, it helps facilitate the physiologic birth process and that cascade of good hormones that keep mom and baby safe. Weighing the pros and the cons of being induced with Pitocin, I would encourage you to talk to your care provider about the benefits, but also the risks that Pitocin carries, and just have an honest conversation from the perspective of wanting to promote normal hormonal physiology when it comes to birth, and how you can have that be a conversation. My personal opinion is that Pitocin is greatly overused in the United States. But I will remind you that Pitocin is a tool in your toolbox. It is not morally good or bad, but I just hope that you will be educated and informed about the benefits and the risks so you can make an informed decision of what is best for your body and your baby and your birth. If you want to know more about how to feel peaceful, prepared, and confident for birth, and want more information on the hormones and physiologic process of childbirth, subscribe to this channel for more videos. Like, comment, did you have a labor that was induced with Pitocin? What are your thoughts on the differences between Pitocin and oxytocin? I want to hear your thoughts, stories, everything. So comment down below, and I will see you guys in the next video. Bye.